as we talk about the topic tonight, the immune system, I want you to know that it is clearly in medicine one of the most complicated subjects ever. There's a lot of nuance to it. There's a lot of subtlety and a lot of complication. And for me, someone who really thinks of himself more as a teacher than a doctor, it's a tremendous challenge to come before you and to make it something that you can really access. And I'll know that we're successful tonight if you have some tangibles, something that you can leave with tonight that change your life, that changes how you interact with your immune system, that changes the way you understand your immune system. And I've worked really hard to try to take this material and put it into practice in a way that you'll be able to access. And I hope that I'm achieving my goal, and I will check in with you at the end to make sure that I have, and we won't leave tonight, I promise you, until you all understand things appropriately. The immune system at its most subtle and at its most complex really only does two things. I just made it sound really complex, and I just made it into something really simple. It's designed to determine the difference between us and them, between yourself, all your cells of your body, and not self, which is the rest of the environment and the rest of the world. And it sounds like a really easy thing, doesn't it? It's just a sorting activity at its most basic. What is it that needs to be protected, and what is it that we need to become vigilant of, that we need to look at, that we need to explore and determine, is this something that potentially is a hazard or not? Pretty clear and pretty simple, correct? The problem is that there are so many elements in the world that are potentially hazardous, not the least of which are the worms, germs, and bugs that are surrounding us all the time. Those worms and germs include viruses and bacteria and yeast and parasites, and when you think about it, the entire world is covered with these things. And our immune system is busy in every single second and every single moment saying, what is you and what is all of this other stuff that is inhabiting you and surrounding you at all periods of time. So it's a tricky thing. Also, the immune system is very involved in sifting out what is occurring in the environment. What is it that we are breathing in and taking in and absorbing and determining if it is friend or foe? Because when you take a big, deep breath in right now, you don't get to be discriminate about what you're breathing in. You might be breathing in perfume, you might be breathing in particulate matter, you might be breathing in viruses and bacteria. You're breathing in, and you're not making the sorting activity of what you're breathing in. By the way, do you want to guess in any single day how many toxic particles you breathe in that your body needs to sort out? 220 million. And just you, just today. So be grateful of your immune system around your lungs at the moment, because it's awesome. Now, in case you think this is only about us breathing in, who else on the planet breathes in? Animals, plants. They're breathing in something different, but they're still breathing in. And everything that goes into the environment eventually goes into our what? Our food. So everything that is happening around you, the horrors and the joys that you see in the environment, you're the environment. It's you. It's in your body. At one time or another, it is eventually going to get in there. Whose job is it to sort all of that out? It's the job of the immune system. I'm making it into a more complicated thing now, am I? Because it's not just saying, is this friend or foe, but there has to be a vocabulary of your immune system to be able to sort out all of these myriad and different items, including all the stuff we intentionally put in there. Many of the medications that we put into our body, I would say most, are completely foreign substances to the body, or we wouldn't call them a legend drug or medication. We'd call them a nutritional supplement or food. So the fact that they are synthesized and can have great benefit if we need them to, that's completely irrelevant to your immune system. You know what your immune system thinks? That's a toxin. That's potentially not self. And that's not a great thing for your immune system. It's additional burden for the immune system. And if you're unfortunate enough to have an interaction with one or more foods that elicit the reactivity of your immune system to respond in some way, suddenly the things that are on your table that look good to you, now they may not be really good, they may just look good because familially or habitually you've had them on your table, so they look normal. You always see the bottle of ketchup there, so you're going to eat it. But it may not necessarily be something that your immune system wants to respond to. And when all this breaks down, when things go terribly, terribly wrong with the immune system, when it stops being able to differentiate self from not self, when it over-exaggerates its response, when it gets confused, or when it stops differentiating, then we start getting into a variety of named diseases. We'll call it asthma, we'll call it allergies, we'll call it inflammation, we'll call it autoimmunity, we'll call it cancer, we'll call it rashes. We're going to put some names on it. And maybe you've not seen all of those names on one slide in one place, because in medicine, we kind of chop all this stuff up. Now, do you know why we chop it all up? So that we can assign a specialist to each and every one of these areas. And when we do that, we create a very, very narrow focus. So there are people that highly specialize in inflammation, and those that specialize in autoimmunity and rashes and asthma and allergy. And there are some individuals that try to do their best in primary care to triage all of this, decide what they can help and what needs to go to a specialist. But this is very much a thought process in medicine, is what is it in front of me and who does it belong to? Now, I would contend that that is a type of thinking which is called label thinking. I don't like it. It doesn't help me as a physician at all. I haven't practiced label thinking ever in the way that I've thought about things. But let me teach you about how label thinking works. Label thinking works is that you take some signs and symptoms. A patient comes in and they say, I have this particular complaint. I have this particular issue, and on exam you find a particular set of findings. And you run some labs and some imaging studies, and you're certain that you have enough data in about that patient. You're using the data to ascribe a label to it. The label has a fancy name in medicine because we can't charge as much if we call it a label, so we're going to call it a diagnosis, okay? The diagnosis is a label. It's a name of something that's there. Now, we do this for one reason, and one reason only, which is to eventually come up with a particular treatment. So we're going to use a pill, potion, powder, or lotion, which is coming off of something called a formulary. It's a list. If you have this label, you look at where the label is on this list, and you have the best thing to do, the second best thing, and the third best thing to do. And although it sounds very formulaic, very rote, there is very much what's called a standard of care, which ascribes for every single set of signs and symptoms, there's a label, and for every label, there's something that you do, and there's one more thing to tack onto it, which is you put an ICD code on it, which helps you to get paid. That completes the entire medical paradigm of label thinking. And if you happen to be caught in this and not getting better, it really stinks. Because you get the label, but you don't sometimes feel any better. And you feel a little caught because the label goes to a certain type of practitioner, and if that practitioner can't help you in the purview that they're looking at, you're kind of a bit stuck. You've gone to the very bottom of the granularity of medicine without getting anything for it. I don't like this thinking. I've taught it, but I don't like it. I like to think differently because nobody likes to be a label. You ever see somebody just celebrate their labelness? Some people do. Like if you're going to the doctor for the first time with a set of symptoms and you say that I have a red area here that is particularly irritating and nasty, and sometimes when certain clothes that I wear are placed on it, it gets even worse. And a physician says to you, well, you have contact dermatitis. And you go, thank goodness. Someone has finally told me what I have, because now I have a treatment. Now, do you know what they told you? They told you that something was contacting your skin and making it red, irritated, and inflamed. Derma is skin, itis is inflammation, contact is contact. But we felt better with the diagnosis. Now, the diagnosis would lead to what? A treatment, which would lead to an ICD code, and everybody seems to be happy as long as the treatment solves things. If it doesn't, you're going to need a different way to approach it. Tonight is just another paradigm of how to look at this. I'm not saying it's right or wrong. I'm saying it's me and a bunch of other people that think like me, but it's not right or wrong. It's a different paradigm. And it's what's called a functional paradigm. And functional thinking is different, totally different. We don't really even care that much about the labels, because the labels are pretty much as silly as they sound. What we think about is what is imbalanced in the body. You'd be a sleuth. You have to turn on a different part of the brain of thinking, a different line of questioning. What is imbalanced in the body that is causing the contact dermatitis, the redness, the irritation? Why is it responding when it didn't respond before? And it's about understanding and not necessarily naming. The naming isn't very gratifying in functional medicine because the name doesn't lead us any closer to the end goal. I'm going to teach you the end goal in a second, but it really deals with dysfunction, the lack of function in the body, and not a naming of a disease. Now, to do this, to get here, we have to start with somewhere. And when I'm working with a patient, the first thing I think about is like, what's the gene pool? We have 20,000 generations of genes sitting in front of me at the moment. Some of them are turning on and some of them are turning off, and we know a lot about a few of them right now. We're about almost 20 years, 18 years into the genomic revolution. We're doing okay. We're learning more every single day about this, and I'm humbled by what I learn and how I can place it into practice with patients. But I do sit there and I think about what are the unique genetic areas? What am I hearing about in the family history that's telling me that this individual has a different name, but is still very much a very similar autoimmune expression? When we start getting a little more granular in discussion with patients, I'm really digging in, asking probably 100 different questions about all the different past influences in their life. What led up to this point? What has occurred for them? Multiple rounds of antibiotics, operations, the use of steroid medication, pregnancies, all these terrible infections. What has had the influence on the immune system up until this point? And then what has triggered it? Why are they in front of me today? What was the tipping point? Because there's usually a tipping point. Symptoms can be non-existent, or symptoms can be very low level, but there's always a tipping point where they suddenly at one point become very exaggerated for many people. It's interesting to me and important. Then I think about mediators. What is it that makes it better? And there sometimes are things that make it better. They tell me a lot because they're telling me how this person, the patient in front of me, is influencing their function. They're changing their habit in their life and creating an endpoint that's making it better. But ultimately, it gets me to the root cause. That's the golden ring. That's what I think about every single moment of every single day with every patient. What is the root cause? What is it that took them from where they were to where they are today? What was the underlying foundational shift that occurred that led to them having this expression of a whole bunch of signs and symptoms? That really helps me, because this doesn't help me so much. When I think about this, it makes me frustrated because it's very hard to get traction with this. But if you think about this a little bit differently and you say, okay, I wonder if all of these things really aren't the end result, but really, essentially, the last domino to occur from an underlying root cause. That something happened and built up under the surface for a long period of time sometimes, occasionally popping up. Yes, I had a very bad thing occur here and this 10 years ago, and another one 5 years ago, and 1 year, and 1 and 10 days ago, and you can see the building of the iceberg and the naming of things that occur, and yet I'm really interested in root cause. And you know what we're going to talk about tonight? Root cause. You will all become amateur immunologists by the end of tonight. I promise. I promise. It's my duty to help you to get there. For most of us, we think about the immune system as a fighter. I can't tell you how many people ask me, like, how do I strengthen my immune system? I know if they're asking me that question, they're thinking in some way, whether it's this guy or Xena the warrior princess, somebody's inside you that you think of as your immune system, and you got to make your immune system stronger. The immune system, the part that actually kills, is dumber than a rock. It is like the very best warrior that we know of, with the most powerful chemical squirting armamentarium that they have, with a horrible sense of direction and terrible facial recognition. Can't see what to attack and doesn't know what direction to attack, but is ready to attack something. That is the heart of your immune system. Do you all want to make that stronger, or are you interested in giving it more intelligence? Some would say military intelligence is an oxymoron. I don't necessarily agree. I think it's the most important thing you can have. If you have a weapon, you need to what? Be very judicious about where and when you're going to use that. Whether it's a single weapon or millions of weapons, you have to be super, super intelligent. Now, I'll ask you the question again. Are you interested in all of the things that make the immune system smart? Or are you interested in just the part of the immune system that makes it strong? Because most of us are used to thinking about this. Anybody here ever take vitamin C in their life? Why did you take it? To get your immune system stronger. You were thinking about step 5. I haven't even taught you these steps yet. But you really were thinking about a very end step, which is make the killer stronger. And I'm hoping to influence you enough tonight to see that that's really not the most important thing you can do. One of the most important things you can do is to first be able to identify, present to the immune system appropriately those things that are outside of you that shouldn't be there, and be able to say, this isn't right. I'm going to present this to the immune system and say, look, please address this because you have to look after this. I also don't want your immune system to over-exaggerate this. I don't want it to see not only bacteria and viruses as bad, but your left elbow and your kidney as bad potentially also. I want it to just be able to present those things to your immune system that need to be addressed. And when your immune system eventually can see that something is really bad, I want it to be activated. I want the immune system to appropriately say, this is definitely not self. I'm definitely going to address it appropriately. I may not know what to do with it yet, but I'm going to definitely address it appropriately. Then I want your immune system to make a lot more of itself. I want it to replicate itself, knowing that every one of those cells that it makes has the same programming to go after that which is not you. Not to go after you, your brain, your skin, some part of your body that's irritating you. I want it to go after those things that are outside of you. And I want it to make a lot of cells that are going to go after those things. And when it does that, it eventually is going to send a whole lot of signals called cytokines. And it's going to send those signals to a big, bad, beefy soldier called the killer cells. And when it finally gets to those killer cells, it's going to activate your immune system. How's that sound? Good? All right. What happens if we indiscriminately activate your immune system without activating your intelligence? What happens if we make your immune system strong, but it's not strong against the right things? Then we get something that's really very dangerous in the body, something that can run completely out of control and run amok. So I'm not interested in the last stage. I'm not even going to tell you about how to strengthen your immune system today. Because in my experience, 30 years of working with this, most people's immune systems are relatively strong. They're just distracted. They're going after the wrong thing. If every single day you're going after food, how much you have left to go after a virus? I measure it all day long in individuals. A very strong immune system dedicated to going after absolutely the wrong things. What I want to do is have us spend our time on all of this stuff. Now, it has fancy names. This is the end of the fancy names. I'm going to make it super, super easy, but I wanted you to see that tonight we're talking about intelligence, not strength. You will not learn how to strengthen your immune system because it was designed to be strong. The whole system is rigged for your immune system to be strong. As long as it is going after the right target, you're golden. If it's going after the wrong target, you got problems. So let's talk about this a little bit. Whether you're flying a plane, whether you're driving a car, the principles are very, very basic and very simple. There's only potentially 4 easy directions that your immune system or your automobile need to go into. Let's talk about them, okay? We have what? An accelerator. That makes the immune system go what? Faster. We have a brake in the car for your immune system. It makes it go slower. It regulates it. And then we have some steering that goes a little bit to the left. And we got some steering that goes to the right. Congratulations, you are all now amateur immunologists. You just don't know it. Because we call the top one Th17. You don't call it that. Most doctors don't call it that, but immunologists call it Th17. It just means the part of your immune system that is the accelerator, makes it go after things. We have a whole set of cells called the T regulatory cells. Just think of them as a break. All right, calm down, everybody. We got to figure out what we're doing before we go do it. That's the T regulatory cells. They're the smart ones. Then we have a whole bunch of cells that steer us to the left, called Th1, T helper cell 1, and T helper cell 2. If you don't want to think about those names, all I want you to think of is this: accelerator, brake, left and right steering. Your immune system is a car. At its very basic, it's a car. Now, it does a lot of complicated things, but it's interesting. You're not supposed to be going down the interstate at 80 miles an hour with your steering wheel cocked over to the left, are you? I want to make my immune system strong. Great. Is your Th1 and Th2, is your steering balanced? I don't know. Well, if it's balanced towards Th1 to the left and you beef it up, you're going to create some problems. This is where you have issues that occur, where you can't deal with viruses, bacteria, inflammation, delayed food sensitivities, irritable bowel syndrome, psoriasis, Hashimoto's disease, rheumatoid arthritis, multiple sclerosis, lupus, and cancer, Th1-related diseases, when your immune system is simply bent a little bit to the left and going there about 80 miles an hour. Well, that doesn't sound great, does it? So maybe the real issue is we want to go to the right. Let's go 80 miles an hour and bang the right guardrail. And if we do that, we've got food allergies, seasonal allergies, asthma, mucus, postnasal drip, eczema, reflux, histamine excess, hives, chronic fatigue, and hay fever. Anybody want those? Where do you want to be steering? In the center. You want to go fast or slow or just the right speed? Just the right speed. When you're going just the right speed and you're going in the center, your immune system doesn't have to be strong. It already is strong. And it already is extraordinarily intelligent. So you look at this, they got the fancy names Th1, Th2, Th17, and Treg cells, or you're just like, I don't know what he said, right and left steering, faster or slower, I can get that. It doesn't matter. What really should interest you is what happens when your Th17 goes up. And what makes that go up? What makes the immune system get overregulated, overamped? And there's a whole bunch of bad things that do that. Viruses and bacteria, parasites and yeast, toxins, food, allergens, and medications, they all essentially take Th17 and make a mess out of it. So what blows this all up? Isn't that what you're here to figure out? If I just told you we're all supposed to be in a place of immune balance, where the immune system isn't over-revved and it's not under-revved, it's not to the left and not to the right, aren't you all interested now a little bit into what blows the thing up? How to get off the rails in the first place? This really, I fooled you all. You thought this was about the immune system. This is about Immune Disruption 101. That's what I wanted to call this. None of you would have shown up. I called it super immunity because you all wanted your immune system stronger. You really don't. I fooled you. You want your immune system what? Smarter. And in order to figure out how to make it smarter, you have to figure out what's making it dumb. What is making your immune system disrupted? Number one thing, stress. Now, half of you have turned your brains off already for me. You've heard this blah, 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 stress bad, but I get things done in my life. I think that way sometimes. I'll tell you the interesting thing about stress, and it's something you won't even recognize probably at first. Stress doesn't make the immune system aggravated at first. Stress has a hormone. The primary one is called cortisol. Now, it's not the hormone that if we walk across the street and we almost get hit by a car and grab our family and we like do a Superman thing and pull them off the road. That's adrenaline. That's not what I'm talking about. I'm talking about stress, the low-level stress, the stuff that eats away at us, the worries of being a human, the complexity, the messiness of being in this life. And it's not easy. Home and family and relationship and work and blah, blah, blah. It's not easy. It's extraordinarily messy. The problem is that stress, chronic stress, suppresses the immune system, puts the brake on the immune system, makes it weaker and weaker and weaker. When you are getting ready for a vacation, this is what happens in America. Go to Europe. They take a vacation for like months on a time. It's a phenomenal thing. They call it holiday. It's a great thing. We get like a week, and that week before is HE double toothpicks, not good. And the week coming back isn't going to be better than the week before. So you're really, really stressed right before it. The best commercial, I think, that I've ever seen are these Corona commercials, these beer commercials. And it has some variation. Tell me if I'm right about this. Ready? It's a person or it's a couple. You don't see them. All you see is them sitting in some chairs on the beach, of course with Coronas between them. And at one point, they take a cell phone and they reach back and they toss it. And you just, in horror, watch it go into the water. And they just pick up the Corona again, right? The symbolism is absolutely fantastic. It's an enduring ad for the last 10, 20 years. It's a great thing. I call what I'm about to describe to you the Corona effect. You get ready to go on vacation. You're so stressed, you're not sick. Nobody's ever sick before they go on vacation. You know when you get sick? Day 2 of vacation. Why do you get sick in day 2 of vacation? Because you take your cell phone finally after being all wound up and you toss it and you take that sip and then you go, God, is it hot? Am I sweaty? Ooh, is that food cooked properly? And then you're out. You're out for 3 days of your 7-day vacation. Why? Because your immune system has finally turned back on. It was suppressed. You relaxed. You took a breath. You took maybe 5 breaths. 3 sips of the beer, 5 breaths. Your immune system comes back and goes, whoa, there's some nastiness happening around here. I got to get to work. And it just starts scavenging, killing, and you have all of the mucus and the fever and the headache and the achiness, and you have an immune activation. It's the Corona effect. If you're lucky enough to be in a first world where you can get antibiotics whenever you snap your fingers, you're also lucky enough to succumb to the bad parts of antibiotics, because the truth is, we still to this day have no real clue how a lot of these antibiotics work. They work. We just don't know how. And we also don't know why people come in clearly without a bacterial infection. There aren't real bacteria there. We can test, we know they're not there, and yet before we got discriminated about this, we would give them antibiotics, and you know what? They feel better. We have no idea what some of these drugs do, except a lot of them don't work the way we think they do alone. We think maybe they're killing a lot of these bacteria, they're ripping off cell walls, they're dealing with membrane permeability, they're doing something fancy. But they're also changing the accelerator and the brake and the right and left steering in unpredictable ways. I just did a literature search before I came over here. You want to guess how many articles describe specific antibiotics and how they affect Th1 and Th2, the right and left steering? Take a guess. 228,000 articles published already about the right and left steering related to antibiotics. So we know there's something going on that we don't know is going on. And if you're on an antibiotic once, probably saves your life. If you got to go on it repeatedly, I think you should question what the heck is going on. You really need to ask yourself, are they helping? Are they hurting? Am I really getting to the root cause? Am I getting to the source of what's going on? Pregnancy is a great thing, except it does a really crazy thing to the immune system. You want to know what that is? It's a very interesting phenomenon that many autoimmune diseases, especially those that primarily affect women, like an autoimmune disease of the thyroid called Hashimoto's, oftentimes will come after the birth of a child, especially a second child. And if you think about it, it makes perfect sense. It's the Corona effect a little different. When you are pregnant, not me, but if you're a woman and you're pregnant, in your body is a small alien that's growing. It's not you. It's half you. It's half your baby daddy, but it ain't you. And your body needs to not attack the baby inside you. So what happens to a woman's immune system when they're pregnant? Gets suppressed. Why aren't you supposed to eat sushi and sliced meats and be exposed to all sorts of people with serious infections out there? The primary reason you're supposed to avoid those things when you're pregnant is because your immune system is suppressed. Now, the immune suppression just doesn't happen the day you kind of do the early pregnancy detection test strip and say, oh, I'm pregnant, and your immune system is turned off. It doesn't work that way. It takes a long period of time. The baby gets bigger. There's more of an immune suppression that happens through the 9 months until you deliver. And then in about 5 days, your entire immune system rushes back in. It's the corona effect. It's the week before you're going away on vacation, your immune system suppressed, your immune system suppressed, your immune system suppressed. Suddenly, within hours, the immune system rushes back in and you get sick. Or your immune system, if you have the tendency, becomes over-exuberant and starts attacking you. Pregnancy is a huge risk factor for the activation of the immune system. So are surgeries. And we don't know all the reasons why. Maybe it's sometimes the intravenous antibiotics that are absolutely required. You're going to open me up. I want like a double dose of those things. Like the inside of my body is on the outside. I want somebody cleaning it all up before you put me back together again. But it's a huge immunologic risk factor. You have to prepare yourself for this. Your immune system is about to go through huge amounts of trauma, lots of inflammation. Sometimes your inner guts are where your outer being is, and they got to put it all back together again afterwards. It's a huge trauma on the body, and the immune system experiences this trauma, and a variety of anti-inflammatory medications and antibiotics, all of which are missteering the immune system in strange ways. It's a huge risk factor. So when we look at the immune system and try to understand that there's this simplicity of steering, and the simplicity of is it going faster, is it going slower, do you want to guess what the most important part of all of this is? I can't teach you tonight the whole Th1, Th2 thing. I'm still learning it. Every day I learn something new about it. It's miraculously complicated and gratifying because every day I can help somebody more. But I'm going to tell you the part that's super, super practical and probably the most important element in all of this today, which is immune regulation. Now, I made it sound like the brake. It's actually more like a clutch. It's more like, how do you want the immune system to be? How agile do you want your immune system to be? Your T cell regulation isn't just a brake, it's a smart brake. It's like anti-lock brakes. It's like it can figure out if you're skidding, it can figure out if you're in the rain, it can figure out if you're on dry land. It figures out what you need when your immune system is regulated properly. So even though maybe you thought I was going to teach you about how to amp your immune system up, I'm really going to teach you how to make your immune system smarter and take you through the guidelines for making your immune system smarter. Number one, get enough vitamin D into your body. Vitamin D isn't a vitamin. We screwed up the naming 80, 100 years ago. Not a vitamin, it's a hormone. And unlike estrogen, testosterone, progesterone, those hormones that trigger secondary sex characteristics in adults, vitamin D is the #1 hormone that controls and regulates what system? The immune system. It's the immune system hormone. Now it's all making sense. Vitamin D at a high enough level stabilizes the immune system. Now, there is a world in turmoil about how much vitamin D you're supposed to take. And I'm going to tell you, they're all wrong. 100% of the recommended requirements for D are wrong. How do you like that for an absolute statement? Because you have a different requirement, and you have a different requirement, and you have a different requirement, and you have a different requirement. What you're taking in is completely arbitrary. It's what is in your blood. We all need a very similar blood saturation of it, but we all have a different capacity to absorb it. Our gut and our genes determine whether we absorb vitamin D at a fast rate or a slow rate. And I will share with you that most individuals that have an immune system irregularity don't absorb vitamin D very well. So you can take the recommended daily allowance. The moment somebody tells me they know how much vitamin D a patient should take, I know they don't know anything. Because nobody knows the amount they need to take. You can guess, but you have to measure it. And when you go to your doctor's office, you should demand, whether every 6 months or every 12 months, you should demand your vitamin D being tested. And you keep playing with the dose until you get it between 60 and 90. Now, that may mean that you're taking 5,000 units of vitamin D a day. And for some of my patients, it may be 30,000 units of vitamin D a day. And when they go to their doctor and they write down, their family practitioner, what amount of vitamin D they're taking, the family practitioner says, "Holy Moses, you're going to kill yourself. Stop taking all of this D." And the request should be, what is my vitamin D level? And if you look at it, it's inside the target range. How much you take in is completely arbitrary. It's what you absorb and circulate that matters to your immune system. So please don't practice population medicine for yourself. When practicing population medicine, there's a bell-shaped curve. There's always people who fit the middle of the curve. Those people are great for a standard dose of D. You have no idea if you're that person or not. And you don't know whether your genes help you to utilize D, carry D, or whether you have the receptors for vitamin D that require a little bit or a lot. This is something that has to be measured. If you don't measure it, you're just guessing. And if your doctor is telling you there's a certain amount you need to take every day, you know that they took about 30 minutes of nutrition class. And they forgot it about 30 years ago, because that's absolutely wrong. This is a life changer. This is a game changer. Vitamin D at the right levels diminishes your risk of almost every type of cancer. Vitamin D at the right levels influences the stability of the immune system, whether it's aggravated or suppressed, whether it's going to the right or to the left. It is the regulator. And sometimes I have to work for 6 months to get to the level just right for patients. We go, it's a little high, it's a little low, we have to figure it all out. And when we get to that sweet spot, wow, it's a huge benefit. It's a huge benefit for these individuals. Vitamin A, it's like the third rail of nutritional medicine. Nobody wants to supplement patients with vitamin A. So you see in most supplements, not vitamin A, but you look at the parenthesis, and it says as beta-carotene. Now, beta-carotene is not vitamin A. That's what's in carrots. In some individuals, they in very small amounts can transform beta-carotene into vitamin A. But vitamin A is a huge stabilizer of the immune system, especially the immune system of the gut, of the membranes of the lungs, of the kidneys, of the brain, of the skin. Any autoimmunity involving those membranes benefits from getting vitamin A into the body at sufficient enough quantities to create a blood level of 78 to 98. I don't know that your doctor's measuring this. If they're not, you have no idea how much to take. And you can't get at this with beta-carotene. You can eat a bushel of carrots every day. By the way, about 60% of autoimmune patients or patients with cancer have the gene that prevents them from turning beta-carotene into vitamin A anyway. So it's not like you're going to get it through food. You've got, unless you're eating cod livers. Anybody here ate cod livers for dinner tonight? So unless you're eating cod livers, this is not a food source that has direct amounts of vitamin A that's sufficient enough for you. You've got to take supplementation that helps that. There's a very, very specific substance called glutathione. Glutathione is a miracle for the immune system. It's like food for the immune system. It regulates the immune system. It strengthens the immune system. It pacifies the immune system. It's a miracle. It's very hard to absorb. So recently, they've developed forms of glutathione called liposomal glutathione. It just is fancy. It means it passes through the gut lining really easily. And if you can get in about 300 milligrams a day of liposomal glutathione, you can produce miraculous results. With some of my patients that have severe cancer or autoimmune expression, that dosage is 10 times that. And things start to regulate. They start to control. Take a probiotic if you've not done it. There's more of them in us than us. You need good stuff inside of you. And most of the things we do in this life, whether it's alcohol or preservatives or foods that aren't exactly matched for our body, destroy the normal flora, the biome in our gut. And that really creates a lot of the programming. The Th1, Th2, right and left steering is determined a lot by the biome of your gut. So take a probiotic every single day. And the other secret, and I think it's the biggest secret, is high-intensity interval training. Now, this sounds like something none of us can do, but it's really super simple. It's the opposite of the Jane Fonda workout. It's the opposite of the hey, put on some spandex and do the same thing at the same level for 20 to 30 minutes, get your heart rate into the specific zone, and then go have a smoothie somewhere. It's the opposite of that. It's going to make you a little uncomfortable when you hear about this because it really changes our notions completely about the way we should be exercising. High-intensity interval training says that we really only need to work out 10 minutes. I know you think I'm a dodo at this point, but I'm not. It wasn't me, it's what the literature shows. 10 minutes every day. Every day. But you got to work out like this. You have to start out at a level 3. You're like, is that like level 3 on my treadmill, my elliptical? I'm like, no. That's level 3 on like the pad on your body between 0, which is where you are right now, and 10, which is your eyes popping out of your head. Level 3. You start out there. And then you surge for 30 seconds. Now, when you surge to a level 9 for 30 seconds, on this board, it seems like something you can do. How many believe you can surge to a level 9 for 30 seconds if your life depended on it tonight? Could you do it? You're also honest. I don't know that you could. Level 9 feels fine on the board, and in about 10 seconds, it feels completely undoable. And you have to push for 30 seconds at level 9. You're not going to hurt yourself. You're not going to get a heart attack. You're not going to throw a stroke. You're not going to throw a wing nut. You're going to simply push your body to a certain extreme, and then you're going to take it down for a minute and a half, and up for 30 seconds, and down for 90 seconds, and up for 30 seconds, and down for 90 seconds, 5 times a day, 10 minutes. Your immune system shifts, your opioids are released, your blood vessels open up, your brain heals itself. It's incredible. Your blood sugar regulates. All the good things in life occur, but number 1, your immune system starts to regulate itself. When you do these surges, your immune system hits the reset button. T regulatory cells go to the normal place. Those Th17 nasty critters that are too overregulated go to the right place. And guess what happens to your right or your left steering? During those 30 seconds, things are all brought into the groove. Why? Because your body thinks you're running from a saber-toothed tiger. Everything is reset. And then you fool it and you go, nah, just was kidding. I'm going to take it down for 90 seconds and just chill out. I'm going to be jogging around, keeping on moving, and then bang, you're going to hit it for 30 seconds and you're back for 90 seconds. 5 rounds a day, total of 10 minutes. Try it. See what it does to your life. It could make the whole thing very different. When we're talking about the immune system and this kind of Th17 and T regulatory cell issue, food winds up being the biggest critter and the biggest problem of all. It isn't what's out there in the environment. Of all of these triggers that makes Th17 go high, the accelerator go high to create inflammation, and the Treg cell function to go low, of all the things, food is the worst of all of it. Diet-induced inflammation is really well described in the literature. It says funny things like about 4% of the population have real food allergies. I agree with that. That's like you eat a strawberry and you look like a strawberry. You eat a nut and you kind of can't breathe. That's about 4% of the population. You've got about 35% of the population with what we call food sensitivities. Your immune system reacts to food. You may not always feel it, but we can measure it. We can see the immune system amping up. And you have about 4% of individuals that actually foods are causing autoimmunity. But by the way, guess how much of the population has autoimmunity? About 4%. Think it's a coincidence? I don't think it's a coincidence. Food has a huge relationship to the triggering of the autoimmune response. So there's a diet that has been coined called the Autoimmune Protocol diet. Well before it had a fancy name, we used to call it a horrible name, which was the oligoantigenic diet. I can understand why you call it the Autoimmune Protocol. It's a much better catchy theme. It's better branding. But essentially, it takes out of your diet those elements that across the population tend to inflame the immune system. Now, I'm not saying these things inflame your immune system, but if your immune system is wonky and you come to me, I'm going to ask you about doing things in a few different ways. I'm going to say, look, we can spend $800, send your blood out, and measure each and every food you could possibly come in contact with and try to see what you should and shouldn't eat. Or we can spend about a year taking a food in and taking it out and rotating it in and out of your diet and seeing what is changing on your labs. Or you can remove a list of things for a short period of time and we'll see if you feel better. What do you want to do? Now this list, brace yourselves. Hold on to your chairs. It's not easy. The autoimmune protocol is not easy. It's easy to say. It's not easy to do. Take out breads, cereals, and grains, dairy, soy, and eggs. Everything white out of your diet. Take the whites out of your diet. Take out nuts, seeds, and legumes. Take out nightshades. Take out artificial anything. Some of you are like, what the heck is left in the diet to eat? Most vegetables, most other proteins, totally available to eat. Some fruits. And we're going to go into that in greater depth. I brought a treat for you today to teach you about all this. This is the autoimmune protocol. It is a cornerstone. If you asked me, hey, somehow we had the zombie apocalypse come and there's no more medicine and no more supplements and everything's really not good, I still have an autoimmune problem, what two things can I do? I would say high-intensity interval training and the autoimmune protocol. It's pretty good because the ding-dongs and Oreos and Fruit Loops aren't around anymore, so you're not going to have a problem getting to basics. Our culture is really filled with processed foods that are mostly these things. If you're aghast at this list and don't think you can lead a life for a brief period of time that takes you away from these things, then I think you ought to kind of consider your diet. There's much more to the diet than this. Now, when we start to think about the big, bad yuckiness in the immune system, which is cancer, it starts to put a chill through everybody because we know it's life-threatening. We know that it can create hell and havoc through the body. And I want to make it super, super simple for you. Next door is our office. We have a copy machine that we love and we hate, like everybody's copy machine. When it's working, it's a wonderful thing. When it's not working, it's a terrible thing. But here's the basics of it. You give somebody a huge sum of money and they give you this nuts and bolts and computery thing. And what you're supposed to be able to do is stick something on the top, on the platen, and press a button and a bunch more come out the bottom. It sounds like a miracle, right? And it's true. Like if we put something in our office on the top and we hit 100 copies, and we turn around and come back, we're going to definitely get 100 copies. But I will tell you, strangely, and it's always a miracle, one or two of them don't look like anything like we put on the top. They're off to the side, they're a little funny, they're bent, or they're not usable copies. And that's not a problem with copies because what do you do then? You identify it, you grab it, you mash it up, and you throw it in the trash can. That's erroneous replication that you finally destroy and take out of the system because you don't want to take bad copies. The body has the same stuff going on. The body is basically a copy machine. Every time in the minutes you've been here, you've made tens of thousands of cells already. And what you hope is that you've made those copies perfectly. But I will guarantee you something. The body doesn't do anything perfectly. If Xerox can't do it perfectly, the body doesn't do it perfectly either. Out of every 100, 10,000, a million copies that your body is making every day, guess what? There's a few of them that are not right. Now, we don't call those cancer. Those are called mutated cells. And mutated cells are okay as long as they are identified and crushed and thrown in the trash can. We have fancy names for that. What's not okay is when the mutated cell takes itself and puts it on top of the copy machine and says, I'm the real source, not the first piece of paper that was up there. That's when cancer cells start to form. That's when there's a life of their own. You've got a bad copy that has snuck its way up to the top of the copy machine, put itself on as the source. By the way, it tends to reach under and it turns up the speed of the copy machine and it makes a whole slew of itself. And the more of itself it makes, it outgrows the space for it and we call it a tumor. Cancer are mutated cells that haven't been identified and destroyed. I'm going to make it sound way too simple, but there are two basic processes if you want to lower your risk of cancer expression. I don't mean avoid it because there's so much more complexity to it. But if you want to avoid cancer and reduce it, you have to have two processes going on that are working really well. One of them is called apoptosis, which means pre-programmed cell death. Do you remember how I said when you have a bad copy, you're supposed to find it, crumble it up, and throw it in the trash can? You destroy it. You don't want that copy going to the top. That's what the body does. It identifies itself. There's inner error checking mechanisms in the cell. And it says, I don't think I'm so good. Bang, it hits a red button. The cell explodes and gets rid of itself. Apoptosis. The second act is called autophagy, which basically means the cell eating parts of itself. When it sees little bits of DNA that aren't right, when it sees bad metabolic waste products inside of itself that don't belong there, there's lots of stuff inside the cell that says, I'm going to eat that stuff up and get rid of it and preserve and clean up the cell. So we want cell cleaning and cell destruction to be going on properly. Now, do you know what makes cancer cells grow and get stronger than apoptosis and autophagy? Cancer cells love two things that are very different than what you love. Your body loves what to breathe in? Oxygen. And your body loves good, healthy food to eat. Proteins and fats and some complex carbohydrates. Cancer cells don't like that. Cancer cells love an environment low in oxygen. It's called an anaerobic environment. And cancer cells love sugar. The simpler the better, because they're trying to replicate as fast as they can. So when you look at the typical American, the couch potato that isn't moving and is eating a bunch of sugar, and you wonder why cancer rates are going like that, it's not a coincidence. It's not a coincidence. Now, there's one way to describe the American diet. All you can eat whenever you want to eat it. I call it free feeding, or the seafood diet. You see food and you eat it. We are so lucky. We don't understand in this country what it's like to have scarcity of food. We don't know what it's like to have to really, really figure it out. Most of us don't. This is the way that Americans live, which is I want to eat, I eat in, and I go by into the kitchen. The days when I work from home, I love it. I love to hang around with my family. I love to hang around the kitchen a little bit, because I find that when I get a little bored doing whatever I'm doing, it's just a few steps away, and I'm not hungry, but it's interesting over there and not very interesting in my office. So I go in there and I graze a little bit, and I bring some of it back. And over the course of the day, I probably eat twice as many calories that I do on days when I'm not in my kitchen. And don't think that the commercial influences in the United States haven't totally understood this and taken advantage of this. They have coined the word the fourth meal. When I saw this the first time, I thought this is the most brilliant advertising ever, and yet is really describing and ensconcing into our head that 3 really isn't enough. When you start getting a little bit hungry, it's okay, because that's really your 4th meal. Not a good thing. The way to increase autophagy and apoptosis, where the cell scavenges itself and gets rid of itself when it's bad, and when it cleans and does its housekeeping, is with something called intermittent fasting. This isn't fun to talk about either. The two dietary things, not so much fun to hear. Because intermittent fasting is the opposite of free feeding. It's the opposite of the seafood diet. What it basically says is, look, what we need to do is create a 7-hour feeding window. Don't fast, but create a 7-hour feeding window. Narrow yourself to a certain amount of time when you can eat. And then take a 17-hour pause. Let your body digest, and while you're doing that, by the way, you're also promoting autophagy and apoptosis. I think it's better if you time that, the largest part of that, while you're sleeping. And we'll talk about more of that in a little bit. Make your breakfast late or make your dinner early, but whatever you do, create a 17-hour fasting window for yourself. Now, this is really the best for almost everyone except those individuals that tend to have hypoglycemia, that tend to go low in their blood sugar anyway. We have to make some changes there, because 17 hours of fasting, you're going to create more problems with your immune system than you're going to solve. It's phenomenal for those people that have insulin resistance, you know, the Milwaukee goiters, you know, the beer bellies. Those individuals that have central adiposity, those individuals that you eat and you pass out, those individuals that wind up having long amounts of of time when they feel extra full. Like some individuals, I talk about intermittent fasting and they say, you mean I don't eat breakfast anyway. How long do you need me to fast? I could fast all day if you needed me to. Perfect. Perfect for the majority of Americans. Not so good for those individuals if you're noticing your blood sugar be down and get jittery, mood changes, hangry, headaches. Not a good thing for those individuals. But autophagy and apoptosis, they're the critical elements. We've made this very, very simple tonight. We've taken something that almost every clinician learns at some point and forgets very quickly after a board exam, and certainly doesn't put into practice. And we've made it very tangible. Even if you've not been exposed to any of this before, you know that the immune system has an accelerator. You know it has a brake, which is really smart brake. You know that it can steer in the right and the wrong direction, and that it's our goal through our lifestyle to create all of that. And I gave you some very tangible tools of seeking the appropriate blood levels for vitamin A, vitamin D, some standard dosing for glutathione, getting a probiotic in, and we talked about the miracle of high-intensity interval training and HIIT, and then started talking about the autoimmune protocol and also intermittent fasting. This tonight was all about us versus them. It was all about the intelligence in your immune system, not the strength, to identify and be able to ferret out what is good for you, what is bad, what is your cells, and what is everything else in the environment that needs to be excluded. And to develop superimmunity, you don't have to make your immune system stronger. You have to make it smarter. And that's up to you. Thank you.